The Coping Cat Program for Children with Anxiety and Autism Spectrum Disorder, a pilot randomized controlled trial. Anxiety is an associated feature of autism. Previous studies have reported between 11 and 84% of individuals with ASD also experience significant levels of anxiety that can impact social and intellectual abilities. Cognitive behavioral therapy, CBT, is an effective treatment for typically developing children with anxiety. The Coping Cat Therapy Program has been deemed empirically supported and probably efficacious by several studies due to the abundance of evidence supporting the study. Preliminary evidence suggests that this program has been successfully adapted for children with ADHD, physical impairments, selective mutism, and comorbid depression. Currently, there are no studies examining the effectiveness of the Coping Cat program to reduce anxiety in children with ASD. The central purpose of this pilot study was to determine whether an empirically supported, individually based cognitive behavioral treatment could be modified to effectively reduce anxiety in children with ASD. The study is the first to use the Coping Cat program for children with ASD. The hope is that because this specific program is well known amongst clinicians, if this treatment is effective, this program could be a primary resource for children with ASD. The participants were recruited from several sources in Southern California. 22 children ages 8 through 14 who were diagnosed with ASD and also had at least one primary anxiety disorder. 12 children were randomized to the CBT condition, while 10 children were randomized to the waitlist. The criteria included having a diagnosis of ASD, an additional diagnosis of a primary anxiety disorder, a full-scale IQ greater than or equal to 70, English as a primary language. Measures included the ADOS to confirm the autism spectrum diagnosis, the anxiety disorder interview schedule used to confirm the anxiety diagnosis. This included a parent version, which was used as the primary measure of outcome. This was a structured clinical interview that allowed information to be obtained about past and current symptomatology, course, and the severity of anxiety. Additional measures included the Spence Children's Anxiety Scale. This was used as a secondary outcome measure. This assessed children's report of anxiety. The CBT intervention was comprised of a 16-week manualized intervention. The primary goal of the Coping Cat program was to teach children to recognize signs of anxiety to serve as a cue to implement coping techniques. The first 8 sessions included skill training. Sessions 9 through 16 were exposure tasks. Measures included modifications to the Coping Cat curriculum made to accommodate for children with autism spectrum disorder. Some examples include after each session, 10 to 15 minutes was spent reviewing content. The session duration was lengthened, and additional visuals materials were included. Procedures included participants that were block randomized to either 16-week CBT intervention or 16-week waitlist using stratified randomization procedure based on age, intellectual disability, and pre-treatment anxiety severity. The primary author delivered all the treatment. Anxiety measures were administered within 1 week of completing the 16-week CBT program. Using the ADOS at post-treatment and waitlist as the recovery criterion, it was found that 58% of children receiving CBT no longer met the criteria for their primary anxiety diagnosis, while 100% of those in the waitlist condition continued to meet criteria for the primary anxiety diagnosis. A mixed model repeated measures ANOVA with group CBT and waitlist as a between subject factor and time pre and post treatment as a within-subject factor was conducted to assess treatment outcome using both primary and secondary outcome measures. Using the ADAS-P, the parent version, 36% of participants remained free from meeting diagnostic criteria for their primary anxiety disorder. Using only data from the CBT group, a repeated measures ANOVA with within-subject factor time was conducted to assess maintenance of treatment gains using both primary and secondary outcome measures. The findings support that children with autism spectrum disorder who completed the 16-week coping CAP program experienced a larger reduction in anxiety symptoms than those receiving no treatment. Over half of all participants demonstrated a remission in clinically significant anxiety symptoms at post-treatment. This is comparable to typical children who complete this program. Additionally, participants in the coping CAP program demonstrated a greater reduction in the total number of psychiatric diagnoses at post-treatment. Limitations included a small sample size, in which statistical results and effect sizes should be interpreted with caution. Outcome measures were based on parent reports. Parents were not blind to treatment conditions and likely invested in the success of the program. This led to a question regarding the possible perception of treatment credibility. Also, relying on measures for typical children may impact the accuracy of measuring outcomes. Finally, the primary author delivered all the treatment. This could limit the generalizability to other treatment providers.